Last Tuesday, a 73-year-old man named Harold Beach walked into the emergency room of Mount Sinai Hospital with what he thought was a minor sore on the side of his right foot. By the following Friday, the surgical team had taken the lower half of his leg below the knee. Harold's wife told the admitting nurse 3 words I have heard from the spouse of every diabetic amputation patient I have ever cared for. She said, "I didn't know." She didn't know because the warning signs in Harold's feet had been screaming at him for almost 3 years. He had ignored every single one, not because he wasn't paying attention, because no one ever told him what to look for. I'm Dr. Walter Brennan. I spent 31 years as a board-certified internist taking care of adults over 60. I have stood at the bedside of 42 diabetic amputation patients. I have signed the consent forms. I have called the families. And I am here to tell you that of those 42 patients, 36 of them showed at least 3 of the 5 warning signs I am about to walk you through, in the months and sometimes years before they walked into my office for the last time on 2 feet. These are the 5 warning signs that an ICU doctor would never, ever ignore in your feet after 60. If you have any one of them, you need to be in front of your physician inside 72 hours. If you have 2, you have a closing window. If you have 3 or more, you are Harold Beach 6 months ago. Warning sign number 1. Your feet feel cold to your touch, but not to anyone else's. This is the single most missed early sign of peripheral arterial disease in seniors. The condition is called intermittent claudication. What is happening biologically is the arteries that feed blood from your heart down to your feet have begun to narrow with plaque. Your foot tissue is not getting enough warm, oxygen-rich blood, so your nerves register your foot as cold even when the room is warm. Test this tomorrow morning. Touch the top of your foot with the back of your hand. Then have your spouse or your adult child touch the same spot. If they say, "Feels normal to me, but you swear it's cold," that is not in your head. That is your circulation telling you in the only language it has. Action: ask your doctor for an ankle brachial index test. It takes 12 minutes, it costs almost nothing under Medicare, and it tells you in numbers what your foot has been trying to tell you in feelings. Warning sign number 2. You wake up in the middle of the night with a cramp in your calf or your foot arch that won't release for 90 seconds or more. Most seniors think this is a magnesium problem. Magnesium deficiency is real, and I covered that last week. But a nocturnal cramp that lasts 90 seconds and recurs more than twice a week is something else. It is called nocturnal rest pain, and it is the second stage symptom of peripheral arterial disease. Your tissues are now so starved for blood that even at rest, with no muscle activity, the nerves are firing pain signals. Harold Beach had this for 14 months. He took magnesium. He drank tonic water for the quinine. The cramps continued. The disease progressed. By the time he showed me his foot, the arteries that should have been carrying blood to his toes were 94% closed. Action: if you have a nocturnal foot or calf cramp that lasts more than 90 seconds and happens more than twice in a single week, that is a hospital visit. Not next month. This week. Warning sign number 3. You notice a small cut, scrape, or blister on your foot that hasn't healed in 2 weeks. In a healthy adult, a paper cut closes inside 72 hours. A blister heals in 5 days. A small scrape resolves in 7 to 10 days. After 60, those timelines stretch slightly, but not by much. A wound on your foot that is still open at day 14 is not slow healing. It is a non-healing ulcer. And a non-healing ulcer on the foot of an adult over 60 has a 30% probability of progressing to amputation within 5 years. 30%. 1 in 3. Why? Because 2/3 of diabetic foot ulcer patients have underlying neuropathy. They cannot feel the wound. Combined with peripheral arterial disease, they cannot deliver the white blood cells to fight the infection. The wound sits there, microorganisms colonize it, and what looks like a scrape becomes osteomyelitis, bone infection, in 8 to 12 weeks. Action: if you have any open wound on your foot at day 14, you are calling your physician tomorrow morning. Not because it might be serious, because it already is. Warning sign number 4. The skin on your lower legs and your feet has begun to look shiny, hairless, and thin. Specifically, the skin between your knees and your ankles has lost the small body hairs that used to be there. The skin has taken on a slightly waxy or shiny appearance, and the color has shifted toward pale, purplish, or in some cases, dusky blue when you let your foot hang down off the bed. This is called trophic skin change, and it is the clinical hallmark of chronic limb ischemia. The skin tissue is so chronically starved for oxygen that hair follicles have died, sweat glands have stopped functioning, and the dermis has thinned dramatically. The color changes when you hang your foot down because gravity is pulling the small amount of available blood into the foot, and it pools because the small arteries can no longer recirculate it. Lift your foot back up onto the bed for 30 seconds. If your foot turns pale white in those 30 seconds, that is called pallor on elevation, and it is a positive Buerger's test. A positive Buerger's test in your living room means severe arterial insufficiency. Harold Beach had a positive Buerger's test in my exam room. He had not noticed the shiny skin. His wife had, but she thought it was just aging. Action. This finding alone justifies an urgent vascular surgery consultation, not a routine referral. An urgent one. Warning sign number 5. You step into a bath or shower and you cannot tell if the water is hot or cold under your toes. This is the most underreported warning sign in senior medicine, and it is the most dangerous one because it means your peripheral sensory nerves have already failed. The condition is called sensory neuropathy. It is what allowed Harold Beach to step on a small piece of glass in his own kitchen, walk on that foot for 3 more days, and not feel it. By the time he saw the wound, it was infected. By the time he saw me, the infection had reached the bone. By the time he saw the vascular surgeon, the foot was non-salvageable. Sensory neuropathy is reversible in its early stages. It is not reversible once you have lost the protective sensation in the soles of your feet. The simple at-home test is this. Tomorrow morning, before your spouse or your aide is in the room, fill your bathroom sink with lukewarm water, about 95 to 100 degrees Fahrenheit. Dip the toes of your right foot in. Then dip your left index finger in. If your finger says warm but comfortable, and your toes say, I can't tell, or feels cool, or feels nothing, you have sensory neuropathy. Action. This is a same-week appointment with your primary care physician. Bring a list of your medications. Bring your most recent A1C. Bring your blood pressure log. Because the cause is going to be one of 3 things: diabetes, B12 deficiency, or chronic alcohol exposure, and your doctor needs the data to differentiate. Now hold those 5 warning signs together as a set. Cold feet to your touch only. Nocturnal cramps over 90 seconds, more than twice weekly. Non-healing wound past day 14. Shiny, hairless, color-shifting skin between knee and ankle, and loss of temperature sensation in your toes. If you have one of these, the window is open. You have time. You go to your primary care physician this week, you get the ankle brachial index, you get the monofilament neuropathy screen, and you get the basic metabolic panel including A1C. You start the conversation. The conversation alone changes the trajectory. If you have 2, the window is closing. You are not waiting for your annual physical. You are calling on Monday morning and you are saying the words, I have 2 of the 5 warning signs Dr. Brennan described, and I need to be seen this week. If you have 3 or more, the window is essentially closed. You are not calling your primary care doctor. You are walking into the emergency department at the nearest hospital, and you are showing the triage nurse your feet, and you are telling them you have 3 of the 5 warning signs of advanced peripheral arterial disease. You will be admitted. You will be evaluated by vascular surgery within 24 hours. And there is a meaningful chance that this conversation, the one we are having right now, is what gets you back home on 2 feet 6 months from now, instead of in a rehabilitation unit learning to walk with a prosthetic. I want to tell you something that may seem like it does not belong in a senior health video. But I have been doing this for 31 years, and I've learned that the patients who do well are the patients who understand that the goal of medicine after 60 is not to add years to your life. The goal is to add life to your years. The single biggest predictor of independent living in the 8th and 9th decade of life is the ability to walk on your own feet. Cognition matters. Heart function matters. Kidney function matters. But the foot is the platform. Lose the foot, and the rest of the system loses its ground. Harold Beach is now in a rehabilitation facility outside Cleveland, learning to walk with a below-knee prosthetic. His wife visits him every day. He told her last week that the hardest part is not the pain. The hardest part is that he keeps thinking about the 4 years that he saw the warning signs and did nothing. He saw the shiny skin. He felt the nocturnal cramps. He noticed the cold. He had a small cut on the side of his foot in January of last year that didn't heal until June. And he just thought it was aging. It was not aging. It was the disease announcing itself. And the only thing that separates Harold Beach from any one of you who has watched this video is that you now know what to look for. Next Saturday, I am going to walk you through the 3 breakfast foods that an ICU cardiologist eats every single morning to keep peripheral circulation open into the 8th decade. 2 of them are in your pantry right now. The 3rd one is at every grocery store in America for under $4. Hit subscribe if you do not want to miss it. In the meantime, tonight, before you go to bed, sit on the edge of the bed and look at your feet under a good lamp. Look at the skin between your knees and your ankles. Touch the tops of your feet. Wiggle your toes. Run the test. 5 signs. If you have one, call your doctor this week. If you have 2, call on Monday. If you have 3 or more, you are not waiting. You are going. That is your homework. That is your insurance policy. That is how you do not become Harold Beach. I'm Dr. Walter Brennan. Stay close. This work does not run twice.